Welcome all. We are going to wait until about 12:03 to get started with the program today. All right, so in the interest of time, I think we'll get started. I want to be respectful of everybody's lunch hour and just extend our gratitude to you all for joining us. Emma's going to be monitoring our waiting room and admitting folks in, and Emma will also be monitoring the chat box throughout today's session. So please enter any questions that you have that come up throughout today's presentations in the chat box, and we'll have ample time at the end of the session to discuss and exchange ideas with one another. So my name is Mallory Van Abema. I work with the Housing Development Consortium. I use she, her pronouns, and I work on the policy team there. And today we are so excited to take a dive into permanent supportive housing and have three of our leaders from local permanent supportive housing providers here to present overviews of the model of housing and the strengths of getting folks into housing with embedded supports, as well as how they've adapted with COVID-19, and also some innovative and exciting updates from our region around commitment to permanent supportive housing being sited all over. So I will advance. So just some logistics. We are recording this session and everyone will stay on mute until we have that Q&A session at the end of today's program. Please, again, share any questions or comments that you have in the chat box and let us know if you're having any technical difficulties. Either Emma Scalzo or myself should be able to help with that. Before we jump in, we're virtually convening and we're likely on the original lands of different Native tribes today. So we're asking you all as attendees to visit native-land.ca. It's a fantastic resource, an updated database of all of the different tribes that have originally inhabited the lands that you are on today. You can learn quite a lot about them. So if you visit grab that link, pop it into a browser, look for your home address. There should be a search bar You can enter the names of the tribes that you are currently on land that they originally occupied. And so together, we're acknowledging that the original stewards of the land that we now occupy and the impacts of colonialism, genocide of the body, mind, spirit, and culture, land theft, and broken promises are still felt to this day and hold incredible significance to the discussion at hand. So today I am joining you all from the unceded ancestral lands of the Taukelma and the Cow Creek Umpqua peoples. So please feel free to share where you are joining us from today in the chat. So what is permanent supportive housing? Some of us may have a really strong foundation and knowledge of what PSH is. Some of us might work in PSH communities, be residents in PSH communities, or have a PSH building in our neighborhood. HUD defines PSH as community-based housing without a designated length of stay in which formerly homeless individuals and families live as independently as possible. So it's a very high-level definition. Our providers later, presenters will dive deeper into what that actually looks like. So why permanent supportive housing? Well, stable and supportive housing equals better outcomes for residents. And PSH is much more cost-effective and compassionate than allowing neighbors to remain unhoused. Addressing cost drivers, because PSH units can average about $331,000 per unit to develop and construct, but we can address cost drivers through restrictive land use, innovative construction methods, local fees, and a variety of other issues that can really reduce the cost of permanent supportive housing development. And this analysis is coming from the Third Door Coalition, which I think Daniel will be speaking to a bit later as a member of the coalition. And this analysis further is not considering the broader cost saving for the community achieved by housing formerly homeless people, embedded medical, behavioral health and crisis intervention, reduce the unnecessary strain on our local mainstream systems. And just an overview of the need. Our most recent 2020 Count Us In survey, which was collected countywide in January of 2020, found that our amount of people who are experiencing homelessness right now in King County has increased since 2019. These are conservative estimates also, and we have 11,751 people experiencing homelessness across the county. And why this ties so clearly to our land acknowledgement and the recognition that homelessness is widely more experienced by communities of color, particularly Black and Indigenous communities. Indigenous folks in King County make up 1% of the total population, yet they are 15% of those who are experiencing homelessness. So that massive disparity persists and needs to be addressed. So we've seen quite a lot of local commitment in the past, and then very recently, we've seen a huge investment by the City of Seattle from the sale of underutilized publicly owned land and new funds that are generated through the adoption of House Bill 1406, which allowed the city to retain a portion of the state's sales tax for affordable housing. They are capturing that sales tax, using that revenue that they've received from sale of surplus land. And the Housing Seattle Now initiative that the mayor announced in August is resulting in major investments in affordable housing across Seattle, including a targeted $50 million specifically for permanent supportive housing units and bringing those units online incredibly quickly within 2 years. This is huge. And further, we've seen some incredibly diverse coalitions come together to address and support vocally permanent supportive housing as the solution for chronic homelessness and getting folks into a state of stability. And so now I'm going to turn it over to Daniel Malone. Daniel is the executive director of DESC, a nonprofit organization serving people experiencing homelessness and living with behavioral health disabilities and other serious conditions. DESC provides survival and crisis services, behavioral health care, and permanent supportive housing. Daniel has been with DESC for the past 31 years, serving as executive director for the past 5. And a major emphasis of Daniel's work has been designing, implementing, and evaluating programs for chronically homeless people with serious mental illness and substance use disorders. So Daniel, it's over to you, and let me know when you want me to advance slides.
Thanks very much, Mallory. Nice to be with you all here today. So I was just going to add a little bit to the excellent introduction that Mallory provided to permanent supportive housing here. I'll start by giving you some context of where I'm coming from and this organization, DESC. It stands for Downtown Emergency Service Center, but we don't tend to use the full name anymore, just going by the initials. The activities we provide at DESC are all focused on meeting the needs of a subset of the population experiencing homelessness, specifically people who are homeless for long periods of time and have usually pretty profound disabling conditions, especially behavioral health disabilities such as serious mental illness and long-time substance addiction. The range of activities we're involved in at DESC include survival services, so homeless shelters that we operate, about 500 beds of shelters altogether. We also are a fairly significantly sized behavioral health treatment provider and have a range of activities in that area as well, including outpatient mental health, outpatient addiction treatment, as well as some specialty services, including psychiatric focused street outreach services to people experiencing homelessness who have who appear to have some kind of untreated mental illness. And we are a crisis, behavioral health crisis provider across King County, running several different services related to that, including what's called the mobile crisis team, which is a 24/7 program where behavioral health professionals who work for DESC are summoned by first responder units across King County when they have encountered a person who is having a behavioral health crisis and they're looking for a different disposition other than taking the person to jail or to the hospital or potentially just leaving them there in crisis. And so we respond to those calls across King County. And then especially relevant to today's topic is that we operate a lot of permanent supportive housing, approximately 1,400 units total, most of that in what we call single site permanent supportive housing, buildings that we own and operate, but some of it in a scattered site approach where we are acquiring units on the private rental market via rent subsidies and then providing ongoing services to the population that we are providing that permanent housing to. So next slide, please. I'll just offer this as a way of distinguishing between permanent supportive housing and other housing for people with extremely low incomes, people whose incomes are below 30% of the area median income. The population we serve has incomes that usually are less than 15% of the area median income, all the way to, down to people with zero income at all. But most people we serve do have some kind of income. Usually it's a disability benefit, the most common one being federal SSI benefits. And that's because the people we're serving are folks with disabilities. So the difference between a permanent supportive housing building like the one on the screen here and other below 30% AMI housing is that supportive housing is intended for a group of people in that income group who also have been experiencing chronic homelessness and who also are living with serious disabling conditions. Chronic homelessness, if you don't know, is defined by not only the length of time somebody is homeless, but also the presence of a disability. And most commonly, the kinds of disabilities that people have who experience chronic homelessness are behavioral health disabilities, serious mental illness, addiction in particular. And so supportive housing is rental housing. You know, this building from the outside probably doesn't look very different from all kinds of other apartment buildings, including apartment buildings for people below 30% AMI. And in many regards, it isn't very different. It is, you know, filled with apartments, in this case, relatively small studio apartments, 350 square feet. And our tenants in the building are the same as people who would be tenants in any other rental situation. Folks have a lease. They come and go as they please. They have obligations under the lease to do things like pay rent. The rent is based on their individual income, so usually the rent amount people pay is quite small. But they are tenants. And the major difference here is that there are robust services on site at the building available to people 24/7. If you go to the next slide, please. I've talked a little bit about the fact that people have disabling conditions, and you know, this is a photo of a favorite person to us here at DESC, who, you know, has the kind of disability that you can observe with your eyes. And I want to sort of use this as a point of comparison to other kinds of disabilities that so many of the people we serve have, people who are experiencing chronic homelessness. And those tend to be disabilities like mental illness and addiction. But when we think about disabilities, especially physical mobility kinds of disabilities, we think about the different kinds of accommodations that make it possible for people to live in housing and, you know, live full lives. And what we don't do with most of those kinds of physical disabilities is say that the disability is going to be a reason that the person cannot be housed. So we don't say to a man like this that, you know, gosh, we'd love to house you, but you're going to have to figure out how you can live in a building on the third floor that doesn't have an elevator, and you need to get yourself up and down the stairs. That's going to be up to you to figure out how to do that. Instead, of course, the approach that we take in our society is to create accommodations for the types of disabling conditions that people have. And so we have wheelchair ramps and elevators and amenities in the apartments that make it possible for somebody to live independently, even with a disabling condition like this. Well, supportive housing, because it's focused on people experiencing chronic homelessness, and that tends to be people who have these behavioral health disabilities, needs to implement a different kind of disability accommodation. And that is usually done in the form of having supportive staff in the building. And so people with the different kinds of behavioral health conditions that I'm talking about might need an array of different kinds of supports, most of which are in the form of individualized care that a staff person can help provide. And that can be through crisis intervention, through counseling, through just helping people manage their day-to-day affairs. It's different than a wheelchair ramp, but it is the same in intent, that it is a type of accommodation for people living with behavioral health disabilities here. Fundamentally, supportive housing should be understood to be housing. It isn't a program. It isn't a place where people are living there in order to be able to be provided with treatment of any particular kind. They're living there because they need a place to live, like we all do. The services and treatment and other things that are brought to them in their housing are all in service of them being able to retain the housing and live as full and independent lives as possible. Next slide, please. So I'm not going to say more right now about supportive housing and what it is. I'm going to shift briefly into kind of recent events, COVID in particular. In this era of the essential worker that I think kind of symbolizes the COVID period that we're in. Our work in overall at DESC has undergone massive change, and that is true of the supportive housing services that we provide to people as well. So as I've noted several times, the people who live in supportive housing are people living with disabling conditions, and increasingly, besides the behavioral health disabilities that I've mostly focused on, we have an aging population of people who also have complex medical conditions, and that has made their risk from COVID, if they were to get it, enhanced. And so we have had to make major changes to our supportive housing work during this time to make sure we can keep people as safe as possible. And that has meant implementing some of the same kinds of protocols that you've probably heard about happening at assisted living places and nursing homes and so forth, where we've really had to restrict the amount of possible exposure to the virus being transmitted to our medically compromised tenants in our buildings. And so that has meant extraordinary restrictions on who can come and go from the building, how many people can come and go. The tenants are still free to come and go as they please, but we've not been able in the COVID era to allow visitors to come and go. And that is a painful thing for us and for our tenants as well. We want to encourage people to have active social lives, but just as the assisted living places have determined that it's just too risky to have a lot of different people coming and going from the place, we've had to make those kinds of restrictions in this time. We've also had to dramatically ramp up the amount of meal service that we provide to people. They all have kitchens in their own apartments and they can cook for themselves, but many people need support in that area. And to reduce the amount of time people need to be spending going out into the community, finding food for themselves and so forth, and also to make up for the reduction in availability of food, such as at meal programs in the community, we've really had to dial up how much food we're able to provide to people. And that means we're basically delivering food to people every day, prepared meals to their apartments, so that they have less reason to have to go out and about in the community and put themselves at risk for contracting the virus. We've been able to do that through some extraordinary changes we've made and some really tremendous support from meal partners that we have, other nonprofits like Fair Start and OSL. Next slide, please. And then finally, as Mallory mentioned, there is this group called the Third Door Coalition that is a somewhat new group on the scene, and it was born out of a lot of the tension and frayed relationships coming from the previous Seattle head tax battle, as it was called, and this group was brought together to find a new way of bringing people together who really have shared interests, people who don't want to see people suffering in our communities, and they don't want to see continued the various effects from having so many people living on the streets and suffering in our communities. And so the group is comprised of people, the leaders in particular, come from academic institutions, Seattle U in particular, as well as business leaders, and in particular people from the hospitality industry, and then also has members from the service providers, and especially supportive housing providers, who've all come together to find a way to finally make a major change to chronic homelessness in our community, and have produced a vision that says that the best way we can tackle end chronic homelessness in the community is by bringing permanent supportive housing to scale. And so Third Door has created a vision for this, including naming how much supportive housing needs to be created, how much that's going to cost, what kinds of things can be done to reduce those costs where possible, but mostly suggesting what the total cost is, and pointing toward different sectors to come up with those resources. Those sectors largely being different levels of government, but also the business community and philanthropy, to bring forward large amounts of resources to produce all of this as the real proven way that we can actually tackle chronic homelessness in our communities. So there's a website for this and plenty of more information, but that's the introduction that I wanted to provide to the Third Door Coalition. And so that brings me to the end. Here's contact info for DESC, and I'll stick around and hear my fellow panelists, and then be available to participate in the conversation afterward. Thank you.
Thank you so much, Daniel. Thanks to everybody on the big DESC team for everything you're doing, supporting residents throughout COVID, before COVID, and after. If you're interested in getting your organization involved in the Third Door Coalition, I think we're probably going to drop a link in the chat, or learn more about it. It's pretty incredible, the diversity of the coalition that's been brought together, and I'm sure they're looking for more support from other organizations. So now we will pivot to Robin Korak. Robin is the Chief Executive Officer at Multi-Service Center, and has been there since 2001, and in that role since January 2012. Robin is an innovative and inspiring leader. She brings an in-depth knowledge of multi-service center and community action, as well as a deep commitment and passion for the bettering of lives of the people in the community. Robin has served on the Federal Way Homelessness Task Force, Community Continuity Task Force, and has been selected to serve on the City of Federal Way's upcoming Housing Task Force. Further, she's a certified housing development finance professional, and serves on a variety of local and national boards in her spare time, I'm sure. So Robin, take it away.
All right, thank you. It's great to be able to share some of the lessons we've learned, as well as learn from other experts in the field as well. So thank you. You can go ahead and go to the next slide. I think many people know one or two things that we do. Very few people know everything that we do. We truly are a multi-service center. We've been around since 1971. We have a food and clothing bank. We have housing programs that run the gamut from rent assistance to transitional emergency shelter and permanent supportive housing, energy assistance, education, and employment for adults and young adults. Our long-term care ombuds program, which advocates for individuals in long-term care facilities. And then we own and operate roughly 650 affordable housing units located in South King and Pierce counties. So you can go ahead and go to the next slide. And I say that the multi-services, it's rare that we find somebody that only needs one service. So it's helpful to have all those services in-house. And then of course, develop strategic partnerships with other partners that provide services that we do not, such as behavioral health. Our permanent supportive housing, again, it runs a range from the lighter touch scattered sites to property that we have with intensive services. So our scattered sites, we have units set aside at some of our properties that are specific for permanent supportive housing. And we do have case managers assigned to those units, but sometimes we'll get a call from the property manager as well to say, hey, this person is struggling with this issue, can you help? But what we find is that in a lot of cases, we end up acting more as a navigator as opposed to some of our other permanent supportive housing, which is much more intensive. Typically, what we're seeing with tenants at these scattered sites are they're looking for resources from time to time, such as financial assistance, getting a driver's license replacement, or getting access to documents they need, referrals to other resources for themselves or their families. And it ranges from one-time help to ongoing assistance and check-ins. And some of the lessons that we've learned is it's really important to establish ongoing communication with tenants and referral sources such as property managers. On the property manager side, first of all, there's turnover sometimes in property managers, so you always have to make sure that whoever's there knows that your services are available, and more importantly, knows how we can help them in their job by providing these resources to tenants. But also ongoing outreach to tenants, because I think for some of the tenants that are living at scattered sites, their lives are very busy, and they're not necessarily wanting traditional case management role or model, I should say. And so it's really important for us to check in every so often and see what their needs are. But flexibility too, because it's very easy to get caught into offering services or resources that we think the family or the tenant might need, when really what we should be meeting is what their stated needs are. And sometimes as you develop that relationship long term, there will be an opening for us to potentially suggest other programs or resources that may be of benefit. But oftentimes early on in the relationship, really what the tenant is looking for is somebody to help them with one particular need. And of course, I think this has been very helpful for us in helping to prevent homelessness, whether it's an ongoing case management that a person needs, or what sometimes it's just a one-time thing that really makes all the difference in helping them to be able to maintain their housing. So next slide. So our William J. Wood Veterans House has been a very different experience, because this property is completely permanent supportive housing. So it opened in 2016, and it's 44 units of 1, 2, and 3 bedrooms with subsidies for homeless veterans and their families. The units are furnished. The VA is co-located on site. MSC provides intensive case management on site as well. And then we contract with a property manager currently to manage the property. And we've seen some incredible successes. We've had people, this is all set aside for individuals, for veterans who are homeless and their families. We've had homeless veterans enter the building that have been on the street for over 20 years. This is the first home that they've had in a while. And one of the lessons learned early on was that it can be as exciting as it is for some of our tenants finally moving into their first home in quite some time. It's a huge transition. And it's very difficult sometimes to make that transition from the coping and survival behaviors that you relied on when you were homeless to now being in an apartment. So that's something that we had to learn. The benefit that we have seen that we weren't expecting necessarily, in addition to stabilized housing, is we've seen tenants, once they got stably housed, we've seen their health improve. And so we've seen reduced visits to emergency rooms, which has been a really great benefit. And then also just seeing tenants be more involved in the community, whether we have community groups coming to the property, but also tenants have reached out to people, support networks that they hadn't been in contact with for a while, or have found ways to utilize their skills to be more active in the community. And that's been a great benefit as well. Definitely some lessons learned when you have a permanent supportive housing property that is all permanent supportive housing. Relationship building with all tenants is critical. It's critical regardless, but especially with Housing First, when you don't require case management involvement, it really takes that relationship building with all tenants, regardless of whether or not they are engaging in services. And sometimes really the most impactful interactions are the things like playing a game of cards with somebody, or just having some social time with a tenant. So that was something that we learned. We also learned that this requires a strong foundation in Housing First principles and everybody understanding those principles. It's really helpful, we found, to have on-site behavioral health options. You really need staff that have strong de-escalation skills and knowledge of harm reduction practices and can implement those. Very, very important. The other thing I think we've learned, when you have a partnership dynamic that is so complex with three or four different on-site partners, is that the communication piece from the very beginning, establishing roles and establishing clear communication is absolutely necessary. Everyone needs to be on the same page about their roles, and can be very challenging because a lot of times there's overlap right? So if you're working, whether you're working with somebody on the case management side who has an issue with their lease, or you're working with somebody as a property manager who has a lease violation, but you know they can benefit from services, it's very easy for those roles to get muddied a little bit. And so it's really important to keep reinforcing what the roles, that each partner needs to work together collaboratively, but that there are specified roles that are there. We also found, so this was a little surprising to us, the challenges that we have, or we've had most often, to security and safety and violations has not been by tenants. It's been really oftentimes with their guests. And with the population that we're serving with veterans, it's not uncommon for other people to exploit them, knowing that they're getting a monthly check, knowing that they're getting VA services. And so we really had to work on the guest issue. And one of the things that we've started to implement and found helpful is really to have 24/7 coverage, so that we are there at the front desk when people come in. We can check guests in and out, and we can help minimize any kind of activities that are not beneficial in the property. I think it's really important when you're entering into this type of housing to really think about what is the staffing model that is going to be most effective for the population that you're serving. And then I think consistency is also important too. And whether it's with turnover or just handling things differently, we found that tenants are very aware of how things are handled. They talk, and if you don't have that consistency, if you don't have a rationale for not being consistent, it can really cause some problems. So next slide. As far as looking to the future, I apologize, I don't know why that's cut off. I think I know we're going to see a continuing need for permanent supportive housing, but one thing I think is interesting is that with the economic impacts of COVID, people that were not previously in need of permanent supportive housing or housing assistance, or had didn't even know what that was, are finding that they need some help. And so I do think there's potential for a broader audience, which is really important for given the economy and the economic impacts of COVID. We of course want to end homelessness. We want to make sure that we're preventing people from becoming homeless. And so looking at this broader audience for assistance, I think is going to be something that's very interesting, and can also help minimize stigmas and misperceptions that exist about people that receive permanent supportive housing help. I think also there is a likely need to identify creative funding models, particularly for properties that are permanent supportive housing, particularly for those properties that serve homeless or low AMIs, which need on-site services to be successful. It's really challenging to find the longer-term investment in services and security. With our William J. Wood property, we were able to structure it so that we did not have a long-term mortgage on the property, so that the money that would normally go to a mortgage would go directly into services. But even with that, it's a challenge because, as you know, costs go up each year, and rents and expenses don't always maintain balance there. And then we're currently working on a large transit-oriented development workforce housing project in South King County, which would incorporate on-site navigation services and other community resources or services, either on-site or in a building right in front of the property. So that is something that hopefully, if all goes according to plan, we'll be breaking ground on sometime next year. I think that's all that I have. I will put our website is www.mschelps.org, and I'll put that in the chat as well.
Thank you so much, Robin. I think I've scribbled quite a few notes about, those housing first principles and how critical they are to have a very good knowledge of for on-site staff. And then what you mentioned about the staffing model kind of being tailored to the community that it's serving. I think that's just a highly relevant point that you're making, specifically on the veteran community that you all operate. So thank you. And next up, we have Emily Meyer. Emily is the Director of Supportive Housing for Catholic Community Services of King County. Sorry, I'm scrolling forward in the slides. She's worked there for the past 15 years, and in this role, Emily oversees a diverse portfolio of housing as well as some shelter programs. Emily also works on healthcare initiatives for the agency and believes that housing is healthcare. So Emily, you are up.
All right, thanks, Mallory. So starting off, a brief overview of Catholic Community Services and Catholic Housing Services. We are a really broad, diverse social service agency, And so a lot of what we do is housing and healthcare, but we do a lot of other work as well. So in terms of housing, in 2018, we provided 7,385 people with permanent housing in about 2,200 units. A lot of that is not permanent supportive housing. So our housing portfolio includes family housing, it includes senior housing, it includes farm worker housing. And so we do have in King County around 400 units of what I would consider permanent supportive housing. We also have some additional, maybe 300 units that I would call permanent housing with support, but that doesn't rise to the level of necessarily the 24-hour-a-day staffing or all of the on-site services that Daniel talked about that you want to provide in permanent supportive housing. We also operate 27 shelters across Western Washington. So this is from Bellingham down to Vancouver that offered 290,000 bed nights in 2018. We do serve both families and single adults in shelters. And then we offer a variety of other services for children and families along with seniors. And so we are able to bring in some of those services to our housing programs. In particular, I think with people aging in our housing portfolio, our partnership with our long-term care system has been really important in providing care for people in housing as they have difficulties with their activities of daily living. So being able to provide some of that support is extremely important. Next slide. So I wanted to talk a little bit more about our experience during coronavirus in this time now, and some of the work that we do before people actually get into our housing in our shelter systems, and some of the impact of that learning as it impacts our future housing development. So CCS has been operating shelters for a long time, and some of our older shelters are typically large congregate spaces. So the St. Martin de Porres shelter is one of our largest shelters. It's in a Coast Guard space, or was in a Coast Guard space. It served around 220 senior men a night, mats on the floor, very close, 2 or 3 inches in between each mat. And the idea is that we know from those point in time count statistics that Mallory shared at the beginning, how many people are experiencing homelessness, and our desire has really been to get as many people inside as possible. And in that spirit, we've also over the years developed a number of partnerships with churches, with other community groups who were interested in hosting emergency only shelter. And so people would get there typically 9 o'clock at night, sometimes 7. So maybe there would be an evening meal, and then people would leave early in the morning, potentially as early as 5 or 6 in the morning. And so it was really just emergency only, safe place to be inside at night. More recently, we have started developing what are called enhanced shelters, where the idea of an enhanced shelter is that people are inside 24 hours a day. They don't have to leave in the morning. It mimics some of the things in permanent supportive housing in terms of having on-site services like case management, nursing, behavioral health services that are available to people. And in those shelter programs, we have found a much more obvious rapid transition to people moving into long-term permanent housing options. In those congregate spaces, it's really just about emergency survival. Enhanced shelter, we have much greater outcomes of people getting into their own place permanently, because it's obviously a much more stable place for folks to be. So when COVID started, there was obviously a huge challenge with operating these huge congregate shelter spaces because people are right next to each other. There's no social distancing. And so early on in the pandemic, we worked with our city and county partners to proactively move a lot of the high risk, particularly older folks, into hotels in March. We also worked with the city and county partners in splitting up a lot of our larger shelter spaces into multiple locations so that people could have greater social distancing. And then along that, we also hired a massive amount of people in order to transform some of our shelters that were night-only shelters into 24/7 operations so that people could really be inside and not need to leave. And similar to so our housing programs, we've undergone many of the changes that Daniel talked about in terms of providing additional meals and not allowing visitors. And in these new shelters that we were operating, we also were doing those things there too, where it was really, the goal was to keep people with getting all of their needs met on site and trying to reduce exposure for folks as much as possible in these 24-hour operations that we were standing up remarkably quickly with really impressive committed staff to making all of that happening. So in that same time, we did move the operations of sort of overtime, maybe transitioning into April, some of our shelter operations just fully transitioned into hotels, either where the city or the county would lease an entire hotel and we would take over operating it, or we would lease out, you know, a floor or multiple floors of a hotel. And so we ended up with some significant operations in about 5 hotels around the county, where we started having significant staffing on site, mostly 24 hours a day in these various different hotels. And so this started this conversation, internal conversation for us, because as we made all of these changes, we recognized that unfortunately we were serving fewer people necessarily because we closed all of the congregate spaces that were providing shelter. And so we couldn't get as many people inside, but the people who were still being served either in more socially distanced spaces, but in the 24/7 shelters that we were running, or in the hotel shelters that we were running, we started to just immediately see better housing outcomes as people were able to work with staff as it was convenient for them, and it worked in whatever else was going on in their life, and they were open to that. We just had significantly better outcomes. And so we started to think more about this challenge of deep versus wide. I think our shelter system, in CCS, we had a fairly wide approach, and we're really moving more towards this deep approach to shelter right now, which I think is helpful in helping folks move successfully into a stable housing situation long term. So next slide. So one of the things that this has really led us to reflect on our experience in operating these 24/7 more enhanced shelters is, I think, what types of opportunities are there for us now that we have significant numbers of people who are in hotels or other 24/7 facilities. We know that our permanent supportive housing has much better outcomes for people than when people are in shelter or experiencing homelessness. We know that our enhanced shelters have much better outcomes than the emergency only shelters. And so now we have all of these people who are experiencing these better outcomes, but we are still in the midst of this national pandemic where there's a limited amount of funding. And what can we do long term? What are our opportunities to look long term for how we can create more permanent supportive housing for these folks in need when we're seeing these better outcomes? Or how can we transition some of our programming towards 24/7 enhanced programming that offers people better outcomes and more support that they need? So one of the things I wanted to mention was that people have likely heard of was early in the pandemic, California launched Project Room Key, which has had some mixed results, but the idea of the program was that California was looking to put about 15,000 people experiencing homelessness into hotels for the pandemic. And as part of that project, one of their intentions was to acquire as many hotels as possible. And California has a Department of Real Estate, I'm not sure of the exact title, but that worked in trying to acquire hotels with the goal being that those hotels potentially could be converted towards permanent supportive housing. And there are other states across the nation and additionally other countries across the world that have tried to model other similar projects off of that. And so I think, unfortunately, with our economy continuing to be what it is, I think it's likely that there will be hotels or other buildings that may become available for acquisition. So as affordable housing providers or people interested in addressing the crisis of homelessness in our region, I think we can look for opportunities in this time for how we might be able to more rapidly create housing opportunities for people. And I think we're right at the end of my time, so I will just stop there.
Thank you, Emily. I want to just express my gratitude to all three of our speakers today, and looks like we've got some time for Q&A, and I'd really love to hear from participants. Any questions that you have for our presenters today? The floor is open. Feel free to unmute.
We got one question for Robin, and it is, how have you found managing PSH units concentrated together? Have you found that PSH units concentrated together are easier and more cost efficient than the scattered sites?
In some ways, I think they're more cost efficient. I definitely don't think they're easier. I think, the advantage is that you have services on site and you have a lot of people, in this case in particular, shared experiences of having been in the military. But when you have a property that where almost all of your tenants, if not all of your tenants, are dealing with some sort of mental or physical or emotional disability, or just a variety of life challenges that either led to them experiencing homelessness or have been exacerbated by that, it's very tricky, because you can have a lot of issues going on at once, and you can have tenants that kind of feed off each other a little bit. So that's been the big challenge. But it is more cost efficient to have everybody in one site. So there are pros and cons.
Thank you. Another one just is in the chat. What percentage of the total homeless population is considered chronically homeless? Does anybody know that?
I think it's generally regarded as 10 to 20% of people experiencing homelessness over the course of a year.
I see another one in the chat here. Does anyone have any strategies to help overcome PSH siting challenges outside of the city of Seattle? Robin, I know you have some operations in the South End. How can we engage the entire region? Question for you all.
I think that is a very good question. I'm not sure I have a solution for that or a good answer. I think it's continuing to, I think we've made a lot of progress on really shifting the focus or the awareness of needs in South King County over the past few years. One of the things I think has been critical in terms of siting is working closely with the city. Being proactive and letting them know well in advance of the project, because otherwise we have seen projects run into zoning issues or into concerns from cities about what the project, misperceptions about the project, misperceptions not just by the city but by the community. So I think getting that early conversation started is really critical.
Thank you, Robin.
There was some helpful legislation that the state passed that defined permanent supportive housing for the first time in state law, that makes it clear that it cannot be regarded differently than other multifamily rental housing in local zoning codes. which is really important because the population groups that tend to be prioritized for permanent supportive housing are the recipients of a lot of stigma and discrimination, and it's not uncommon for local jurisdictions to want to either zone that kind of housing out of existence in their communities or to limit it to undesirable places, within their jurisdiction, like, industrial areas or things like that.
Mhm. Mhm.
Here's another question. As an individual who believes fervently in housing first model, what can I do? Is there enough momentum amongst city officials, decision makers, and businesses to invest funds for this to happen? How can I support this?
Well, yeah, I really love that question so much. And not sure I have a wonderful answer for you, but I think we've made great um, gains in bringing support to permanent supportive housing as the intervention that needs to be prioritized. What we haven't been successful at yet is the same thing that just applies to affordable housing generally, is that we haven't convinced ourselves, our communities, that housing should be regarded as a human right and therefore provided for everybody who needs it. And so I think there's some headway that's been made and is maybe gaining some momentum about permanent supportive housing, particularly being a policy priority for and funding priority for local and state governments. But we still are in the place of just, kind of funding whatever we can come up with money for, as opposed to funding at the level of the demonstrated need, which the state did a report. OFM, I think, did a report within the last year or so that I think indicated a statewide need of 16,000 units of PSH, I think, and the need in King County, Third Door Coalition has estimated at 6,500 units. That's to deal with chronic homelessness. The new regional action framework that's coming out about homelessness indicates more than that, because you need to factor in people who would be falling into homelessness later or not living in appropriate housing at this time for their needs. So it's a lot, and it's going to be very expensive to do. So there still remains a lot of work to be done to generate the political and public will to make this happen.
And I would, if I can just add real quickly, I agree with everything that Daniel said. I think that's so important. I think on an individual level, it's education about the housing first model, because the most common question I've gotten from the general community is, why don't we require people to be sober or to be in treatment prior to giving them housing? And helping people to understand that really by having that stable housing first, which is a basic human right, people are more likely to be successful in engaging in those types of services than if we're requiring them up front to do that. So I think that's an important piece. And usually when I explain it that way, people seem to better understand it. So I think a lot of individual one-on-one education is helpful as well.
Thank you both. I don't want to miss Kathy's question, which I think is tied to the percentage of folks that are chronically homeless in King County, but she's mentioning or asking what percentage of the homeless population is considered eligible for PSH in King County. And I would presume that those numbers are the same. Daniel, do you know about that?
Yeah, I think that's essentially right.
Okay.
And to some extent, these questions are they lose some of their meaningfulness to us at the moment because there's such an enormous gap overall. I mean, the coordinated entry, kind of wait list, if that's what it is many thousands of people, and then there are just a handful of units that come open every month. And so, it's we're so far from meeting the need that I think, I tend not to think too much about, those types of proportions.
Okay. So we are at time, we are beyond time, and I expect that folks probably have to jump off to other engagements, but HTC is just so grateful for all three of our speakers taking time out of your day, and for all of you that joined this webinar today. I do want to plug quickly, the 2020 Affordable Housing Week is coming up in October 12th through 16th. And we're hoping to use this conversation as a spin-off for a lot of the comments that we're seeing in the chat box about how do we spur regional siting of permanent supportive housing, and how do we get local governments outside of the city of Seattle and some within South King County on board to create, the pathways to the easiest way to site and construct and open the doors to permanently supportive units locally. So please check out the Affordable Housing link and stay tuned for the date for a kind of a deeper dive in regional engagement around permanent supportive housing. So thank you all again. I hope you have a wonderful afternoon. Yes. Was someone jumping in?
I think we just want to remind folks to attend the Friday's member meeting. It starts at noon. It's really, we're voting on a lot of advocacy priorities for next year. So it's really important that we have quorum. So represent your org and pop in for an hour. That would be really helpful.
Absolutely. It's a packed agenda, and it's really, really critical that we have a good representation and quorum from our members to approve our agenda for the 2021 session. Thank you all again, and I hope you have a wonderful afternoon. Stay healthy, keep your windows closed until the air clears, and take good care.
Thank you.
Thanks, everyone.